are here at TEDxBeaconStreet, and I'm sitting down with Dr. Shad Deering, maternal fetal medicine physician. But I don't know, should I call you doctor, or because you're also an Army colonel, Dr. Colonel?
Right. Everybody gets confused. It's either one. Doesn't matter.
Explain this a little bit.
So I'm an active duty Army colonel. I'm the chair of the Department of OBGYN at the Uniformed Services University, which is, we like to call it America's Medical School. And I am also a high-risk pregnancy doctor. So we have 17 of us in the Army.
Wow. Very fascinating. So let's talk about your talk, your TED Talk you just gave. It's called Why Doctors Should Play with Dolls.
It is. So one of the things that I do is I do medical simulation. And we do it the goal is to improve patient safety. It comes from the concept that what we don't want is we don't want the first time someone goes in to an emergency for it to be the first time that they've ever done a procedure.
Yeah.
And the problem is if you don't get to practice on real patients, and we shouldn't be practicing on real patients. In an emergency, the most experienced person should do it, but if we keep doing that and pushing people out of the way, then we never get anybody trained.
It's like if there's a football field goal kicker, you want your best kicker in there if it's a game-winning field goal. It's like that, but it's like every field goal is a game-winning field goal.
It is, and it's life or death.
Yeah.
And so we need to practice.
Yeah. Very interesting. And so you kind of said this just now, but I want you to expand maybe and put in your own words. Why is this an idea worth spreading? That's sort of the TED message.
Sure. It's something, it sounds simple, but people kind of, especially when we've talked about medical simulation, people look at it as, oh, you're playing with mannequins. Oh, it's not real life. The way I was trained was different. But we have data. We actually have good data. We have good data that we can decrease brachial plexus injuries, which is a nerve injury in babies who have a shoulder dystocia. We can decrease that fourfold if we train people.
Yeah.
We've shown that if people have other complications in pregnancy where they need an emergency C-section for certain reasons, that we can cut the time from diagnosis to delivery in half. I mean, there's so much evidence that's coming out now. And what we want people to realize that. And the national organizations are starting to. And we want to push that faster and further because it needs to happen.
Yeah. Great. Well, thanks for sitting down with me.
Absolutely. Thanks for having me.
Dr. Shad Deering, he's a maternal fetal medicine physician. His talk is called Why Doctors Should Play with Dolls, and you can check it out at TEDxBeaconStreet.com.